Hi everyone, and welcome to week 5. This week is going to be a little different from our previous weeks, but I will get into that in a few minutes. The objectives this week include being able to list and explain the factors that impact a person's health, create an argument to what extent does a person choose their own health, work with your discussion board group to create a document that highlights one of the following topics, and explain how the topics listed above impact public health. The items to complete this week include a Chapter 13 and 14 quiz, your collaborative PowerPoint assignments, then you will complete a survey on which group had the best PowerPoint. You will create or complete a worksheet that allows you to reflect on the group process, and then of course your discussion board post. Oh, I spelled Blackboard wrong there, but let's go to Blackboard for a minute so I can show you how to complete the group assignment. So under week 5 for this week's assignments, each group is assigned a different chapter. So if you're in group 1, you're chapter 15. If you're in group 2, you're chapter 16. Group 3, chapter 17. Group 4, chapter 18. And group 5, chapter 19. What I have done is I have created a place for you to work on the PowerPoint in the discussion board. So go to your group's discussion board. When you get to this page, here's the page where you can really start creating tasks and assign roles. Under Collaborate, this will bring you to a Collaborate session where you can meet live and face-to-face on Blackboard. That's Collaborate. You can schedule time to meet with your group. File exchange is just as it sounds. Here's where you can share files with each other. Again, I would strongly suggest you use Google Slides to complete this. That way there is live editing and you can see as each other edits the document. The group discussion board you're familiar with. Group tasks. So here you can assign group tasks for your different group members. You would just click on Create Group Task and then the task name and description. That might be very helpful for some of you. This is of course slow because I'm doing a video while trying to do this. And then send email. So this may also be useful to start the communication. Under group tools, you can send an email to your group. It's not working because I'm the instructor and there's no one in the groups yet, but you can send emails through this as well. So hopefully you got started last week, so it's not as stressful this week. After you complete the group process, you are going to complete a group reflection. Now this is per person will be completing that, and it really allows you to reflect on this process and to think about why did I assign a group activity. And so the what for this is to discuss what was your topic, what did you specifically research for your topic. So this is not group, this is what did you research for the topic. What do you think the goals for this project were, and to list 3. What have you learned so far from this project? On a scale of 1 to 10, 1 being poor, 10 being excellent, how would you rate your efforts in this group project? And then I'd like you to explain why you gave yourself that score. So if you gave yourself a 7, explain why you gave yourself a 7. Thus far, what are 2 things you like about contributions to this project? And then what else do you need to complete this project? And then lastly, discussion board. This will bring us to Chapter 13. Do people choose their own health? The leading actual causes of death include tobacco, poor diet and physical inactivity, alcohol consumption, microbial agents, toxic agents, motor vehicles, firearms, sexual behavior, and illicit drug use or illegal drug use. Almost half of all deaths are preventable. Most are premature, meaning that people are dying before the expected age. Most are caused by behavior. So the behaviors I choose lead to my death. And these tend to be the targets for public health intervention. So these are the areas where public health officials are trying to work on to reduce deaths. When we look at tobacco, as you know, it causes cancer, contributes to cardiovascular disease, chronic obstructive lung disease, infant deaths due to low birth weight, and burns. For poor diet and physical inactivity, these contribute to obesity, heart disease and stroke, diabetes, and also cancer. Misuse of alcohol contributes to motor vehicle fatalities, chronic liver disease and cirrhosis, home injuries, drownings, fire fatalities, job injuries, and also cancer. When we look at public health interventions, what should be the interventions? Should it be education? Educate people about the dangers of these behavioral choices. Regulation, so regulate what products people can choose to use. Or prohibition, so completely make it illegal to engage in behavior. When we look at education, the purpose is really to provide education and information. Right? So think about the tobacco campaign. Smoking is bad. Or having recommended dietary allowances. So how much sugar should you eat a week or a day? How many calories should you eat a day? Those would be the recommended dietary allowances. The purpose, again, is just to educate and inform. We also have health education in school. However, sex education is still considered controversial in school. And then also physician recommendations can be effective. So instructing doctors to talk to their patients about health risks and behaviors. Then the next we have regulation, so that there are laws against murder and assault and rape. There are traffic regulations, speed limits, stop signs, stop lights. There are restrictions on alcohol, drugs, and tobacco use. The age that you can legally purchase and use those products. Age restrictions on many behaviors, sex, driving, alcohol use. And then while we do have restrictions on the age of consent for sexual behaviors, other choices as it relates to sexual behaviors is really hard to regulate. You cannot force people to use condoms, to make good choices when it comes to their sexual health. And then we have prohibition, which is banning or making something illegal. The 18th Amendment banned alcohol use, was effective in reducing diseases caused by alcohol. But it was ineffective in other areas, which ended up repealing that amendment. Prohibition against drugs such as heroin, marijuana, although that one's changing, and cocaine are generally accepted. The general public accept that heroin should be illegal, cocaine should be illegal. Now, marijuana the public opinion is changing on what the public feels is acceptable. Prohibition is no longer considered acceptable. As you know, many states have been changing their laws regarding marijuana. However, I just want to make sure it's clear that the federal government still lists marijuana as a Schedule I drug, meaning there is no accepted use for medical or recreational use. And if the federal government wanted to come into states and uphold that law, the federal government law overholds everything. So even if in Illinois, smoking marijuana is legal if I'm at my age, right, recreationally. If the federal government wanted to come in and arrest me, they certainly can, because that law trumps the state law. And then we look at this war on drugs idea. Many think it is not working. They think that even using the term the war on drugs is an inappropriate term. It's very expensive. It empowers criminals at home and terrorists abroad, meaning criminals at home and terrorists are making money on the illegal drug importation business. And it also sends thousands of people to prison for minor offenses. All right, this brings us to chapter 14. We're talking in this chapter about psychosocial factors, how it affects health and health behavior. When we look at behavioral and the social environment, the most important predictor of health is socioeconomic status, which is also shortened to SES. There are health gradients at all levels of the social scale. In addition, health is affected by gender, marital status, race, and ethnicity. In the US, racial and ethnic minorities have poor health statuses compared to whites. And health disparities are a really big concern for public health. So what are the effects of SES, which is the socioeconomic status? They find that people who are in poor, low resource areas have less access to high nutritious foods. It's less sanitation. Even the physical conditions of those environments are poor. When we look at SES, socioeconomic status, so think about income and education, higher levels of those lead to more healthy behaviors. And then people who have more education, higher incomes, have more access to medical care and quality medical care. Some of the psychological factors as it relates to socioeconomic status is stress. Mortality is increased after the death of a spouse, the loss of a job, divorce, etc. Stress increases risk of heart disease and the common cold because it decreases the effectiveness of the immune system. And just daily hassles can increase stress in a person's life. There's also this idea of social support. When people have a strong social support network, they generally have better health outcomes. There is a study called the Alameda study, you can read about it in your book, that looks at the impact of having a strong social support network and health. In addition, having a strong social support network can also buffer the impact of stress. So people who have strong social supports around them are better able to handle stress compared to those that do not have an effective social support system around them. The psychological models of health behaviors, one of the models is called the health belief model. And it basically says that people are more likely to change the behavior if they feel their behavior is, that they're vulnerable to that behavior, that engaging that behavior is a threat to you, that that threat is serious, and that you can do something to take action to change that behavior. And so, again, I'm vulnerable to that threat. It can affect me. That threat is serious. It's going to impact my health. And there is something I can do to change that threat. Under this model falls this notion of self-efficacy. And self-efficacy can be increased by having previous successful performance. Self-efficacy is the belief that you could do something. You have the ability to change your behavior. So it's increased by having successful performance. It's also increased by seeing others successfully perform whatever health behavior it is or health change it is. And especially if the person they're seeing perform it is a peer, someone who's close in their age and close to characteristics as that person. Another model of health is called the ecological model of health behavior. And this involves several factors. You have intrapersonal level, which is your psychology, yourself. Interpersonal level, which are friends, family, and coworkers. Institutional level, school, workplace. The community level, so churches, communities, organizations around you. And then public policy, so government regulations. We think about health promotion programs. Many of them are geared towards changing a certain behavior in a community. And public health tends to be more widespread than looking at a certain group of people. It's looking at a community of people. So here's an example. The AIDS prevention in San Francisco in the 1980s. And at this point, AIDS was a new disease. It was a deadly disease. That's not to say it's not deadly now. However, the treatment available for HIV/AIDS is very effective. And it targets different levels of influence. So at the intrapersonal level, they were trying to show people who engaged in risky sexual behavior. At this time, it was mostly men who have sex with men, to show them that they are susceptible to infection, that this is a risk to them. There's something they can do to reduce that risk, use a condom, and that they are capable of making those changes. They are capable of using a condom in risky behavior. At the interpersonal level for the same prevention, right, so AIDS, San Francisco, 1980s, that their peers support this new behavior. So there was a campaign to show men who have sex with men talking about using condoms and why it's important to them to use condoms. Then you look at the community level. So here there were a lot of educational programs for bartenders in gay establishments to promote the use of condoms and to talk about the use of condoms. I'm not sure if you've ever heard the term, but a bartender is like your therapist, right? Because they're there, you're drinking, opening up. So they really were trying to educate bartenders. And they also distributed condoms to gay bars and bartenders to hand out to make it readily accessible. Then the last level is this public policy level. So they offered free confidential HIV testing. So that hopefully if someone tested positive for HIV, then they were either going to disclose to their partner or to make changes to engage in safer behavior. One of the effective ways to improve health, but most difficult, is really changing the environment. It's easier to change, I don't want to say it's easier, but changing the environment then changes the behavior of many individuals. So it impacts a larger amount of people. It also changes the focus from blaming the victim or the person at risk to just changing the environment. Where you see this being very affected is in injury control programs, where you look at workplace safety standards and increase those standards to increase the health and injury status of the employees. It was also effective in tobacco control programs, where the states now mandate that you have to be 18, in some counties it's actually 21, to purchase tobacco products. But not only having that law, but training store owners and places where cigarettes are sold so that they understand the importance of upholding the law and making consequences if you are caught selling tobacco products to minors. Now there's new thinking and new ideas. Now how can we take that idea of changing the environment and apply it to help improve diet and physical activity, which especially now during COVID are increasing significantly. So more people are becoming obese and more people are becoming physically inactive. This concludes the PowerPoint for this week. I hope you have a wonderful week, and as always, please let me know if you have any questions or concerns. Have a great week.